Wild Health is about optimizing you. We use genomics, blood work, biometrics, microbiome assessment, many other tests, and a conversation with you to come up with a full health optimization plan. What's the perfect diet, exercise, and supplement plan for you and only you? The Wild Health podcast is about optimizing all of us. Here we cover the cutting-edge science that gives you the base to be able to apply the personalized plan we give you as a patient. To sign up as a patient, go to wildhealth.com. Or if you're a physician or health coach and you want to learn how to do this for your patients, we're happy to help as well. Wildhealth.com for all the information on becoming a patient or working with us.
What's up, everybody? Welcome back to the Wild Health Podcast. I am today's host, Steve Weatherholt, one of your health coaches with Wild Health, and we are continuing a series here that we started a while back, and we're going to pick up with the Wild Health Voices, which is a fun-filled series I'm going to be leading us through, where we talk to people that practice precision medicine in Wild Health, or AKA our employees, our friends, our tight-knit group of people that work together behind the scenes and on the front lines like it's a crazy thing, with patients every single day. And so I'm here today joined by my coworker and, more importantly, my friend, Meghan Jones. She's one of our physicians here at Wild Health, and we're just going to have a little fun today talking about you, Meghan. So how are you doing today?
I am pretty good today. We're having our end of October Halloween week with kids. So there's 1 million things to do and dress up for, and
fall activities, pumpkin
order
patches.
off Amazon last minute. So.
Yeah. Oh, we did the Amazon order for the costumes as well. So
yes,
that's awesome. Well, as we record here today, it is coming up on Halloween. You guys have a costume planned?
I'm a little bit sad. This is the first year my kids have had very strong opinions on wanting to be their own things and not letting me do a joint
the group costume,
family costume. So I think we're just, it's all going to be pretty random. I think we have a mermaid princess, a dinosaur. I may break out the pumpkin costume.
Nice.
That my mom made in the 80s. And Dustin still has temporary arm sleeves from dressing up as one of their head coaches. So he might have to go as Maui or something. He's got some temporary tattoo sleeves.
Oh, that's awesome.
Yeah.
Well, let's jump right in here. So like I said, today we're just going to be going through this series, Wild Health Voices, where we're going to be interviewing employees and just talking about where we are started, what led us to where we are, maybe get into some of the things that you do to keep yourself healthy and fit. I think that's one thing that we always like to highlight as a part of this company. And I mean, there's so many things I love about working for Wild Health and what we do and the mission and all of these things. One of my favorite aspects is that all of us live what we teach. And I think that's a really powerful thing when you get into healthcare, especially. And so we'll certainly talk about some of that. But I want you to take me back to the beginning. Why you, Meghan Jones, decided to even get into medicine? Where were your humble beginnings there, and what did that look like?
Yeah. I don't remember one big pivotal moment. I actually grew up telling everyone that I was going to be a vet. And at some point in high school, I think I just got more curious about humans in general. But I had some early exposure, through some family friends of some rural medicine practices, some global medicine opportunities, trips where just seeing healthcare being taken to those that, truly need it. And I mean, everybody does, right? But
yeah,
I think that kind of helped, shape a little bit of that. And then, just growing up in sports, my dad was a physical therapist. So kind of being, healthcare world in some senses, just kind of pointed me towards humans a little bit more. So yeah, I would say that was kind of the initial interest and start. And then through college, kind of figuring out what does healthcare look like? Was that going to be physical therapy? Was that going to be, ultimately ended up being medicine. And yeah, I don't know how. Do you want me to keep rolling through like?
Keep rolling, man. Give us the story. You're doing great.
Yeah, so I had some like kind of global health opportunities that I think solidified wanting to do medicine. I went to like a smaller undergrad in West Virginia called West Virginia Wesleyan. Got to play soccer there. It was super fun. And then kind of continued on, went to West Virginia University for med school, where I again got to do like a global health track. So I got to do some extra months my last year in Ghana and Guatemala.
Nice.
Coming alongside people already practicing healthcare there, just getting to see different places of practice for sure.
Yeah.
And I actually, it was really hard to decide what to do. I liked a little bit of everything, but not any one thing like altogether. And so that kind of led me into emergency medicine. I got to see all ages, got to do some procedures, but not necessarily be in the OR. Got to like do more shift work and then leave the hospital. And so I liked emergency medicine, did my ended up going into residency for that at Ohio State University. And then got to do like a good bit of my emergency medicine career through the pandemic, which ultimately, among other things, kind of led me away from the emergency department and getting to do precision medicine.
Yeah. Tell me a little bit more about that. So at that point, you were doing emergency medicine, pandemic hits. Where's the pivot to decide to look into things like precision medicine, which is what we practice? And what was your like leading moments to deciding that this was the style of medicine that drew you in?
Mm-hmm. Yeah, I think there was a chipping away for a while, right? The pandemic was just so heavy for so many people. And I think the emergency department ended up being a big catch-all for a lot of things. And that just kind of, for myself personally, I feel like I just burned out real quick. Was kind of looking for other avenues. And I think not only, you're practicing like reactive medicine all the time in the emergency department. And throughout that, my dad was having a lot of health problems, like very long standing cardiovascular disease history.
Mm-hmm.
And, so he was declining through that. And I think seeing and starting to think about like, man, what would this have looked like if he had had some different information early on in his life? Just starting to think more about like the power of preventative medicine. So that all coincided with the burnout in the emergency department. And then serendipitously, Julie Fouché and I kind of reconnected. And she was like, have you heard about what Wild Health's doing? And so, kind of got into like the training program. And so I feel like all of that kind of snowballed into feeling like this was, worth pursuing and learning more. And, I was fortunate enough, I was in a position I could dwindle down on shifts in the emergency department at the same time and ultimately kind of leave to shift to doing this as my main thing.
Yeah, that's awesome. What do you see? So we hear about this a lot, especially with the pandemic. There's been burnout from a lot of physicians and healthcare workers, nurses, all people in the healthcare industry, and leading to shifts in their careers. And then for you, recognizing the importance of preventative medicine, having a personal story with family members and just thinking about preventative versus reactive medicine.
Good.
As far as like now that you're fully immersed in preventative medicine and precision medicine and looking at, nutrition and sleep and exercise as big tools that we can use with people and blending that with all of the medical data and the information and even medications from time to time. For you, what is the most fulfilling thing about what you're doing now compared to what you were doing before?
Yeah, I think it's getting to see people like have that light bulb moment of what they can do now, like that they're getting to make choices that are ultimately going to lead to a different outcome. Versus like all of my patient interactions were just, not all of them, the vast majority were like fallout of lots of small decisions, right, that led to ultimate outcomes of chronic disease. And so I think getting to see people, even if they're already in like those early stages of chronic disease, seeing that like it's not hopeless, it's not, there are things that can be done and reversed, and just, getting to see people like see those changes happen, see them get to do more things just like day to day with their family, with their kids. And I think just getting this like refreshing view of people like investing in their healthcare versus like a lot of times people get so far down the system, understandably, it's just, it becomes a little more like paternalistic sometimes. And they're just like, you fix me because I don't know what else to do. So to get to see people really, take the time and autonomy, just invest in their own health has been really cool to see.
Yeah, love that. What is one of your or some of your favorite things about how you practice medicine now?
My favorite things. I think getting people that are like, again, have that, they're kind of early on in their stages of like, just like learning more about like health in general, about their own bodies, things that we just aren't taught or told. Really things that like, I feel like are coming to light now and circulating more in mainstream media that maybe I didn't even learn in school like 15 years ago. So having those like early stages of health literacy has been one of my favorites, and just getting to like partner with people in that. And again, not like tell them what to do, but have that conversation with them about like what looks sustainable right now, what looks like something we can do, start those small baby steps. That's been super fun. And I think like just as like a personal, getting to see like female athletes,
right?
And I say athlete, like just anybody like doing movement, right? Just kind of have that turning point of like realizing what it looks like to take care of their body and have an awareness of like hormones and feeding ourselves and lifting heavy things and all that. That's been, I think, personally one of my favorite things too.
Yeah, that's awesome. Yeah, like you said, it does very much feel like we're in a cool time right now where the tide is shifting with a lot of things. The health information is out there a little bit more. More people are consuming it. More people are thinking critically about it. They're realizing, hey, like exercise does do a lot of important things for my health, and it is a big rock. And nutrition is super important to, improving my blood work and improving my overall health and well-being, even my mental health. All of these things like weave together. And so like, I almost feel like we as practitioners here are sort of like a funnel for helping people who are consuming so much of that decipher what's going to be right for them and the things that are going to really impact their health and find the useful things, because so much of that information feels super useful, and it, what information works best for that person is sometimes hard for you to sort out on your own. And so having practitioners like yourself to like hear those things, and our patients are always bringing latest and greatest things they've heard to us, and we are thinking about those things as well. And it's a great opportunity for us just to continue to learn and consume those things. And kind of on that same note, like, what are some of your health routines? Talk me through like a day in the life of Meghan Jones. You're thinking about the things that go into making your health what it is and the progress that you've made personally yourself in any aspect. What does that look like for you?
Yeah. Whew, that's hard. Only I say that because I feel like it's always shifting with having like small toddlers, right? They're like early school age kids. So we try our best and like fall short some days and try again the next day. I would say kind of on my best days and when I'm having it all together. I would say, biggest things, like definitely feeling like in that life stage of where we're doing something is more than nothing. And so some of the things I try to fall back on routinely are like, can I get some movement in today? Typically for me, that looks like maybe 2 to 3 CrossFit classes a week. That is just like, that functional fitness has been just really instrumental in like shaping, how I view what the body can do, what I can do personally. Like it's shaped a lot of my health practices. And I love the community and accountability that they're going to ask me where I was if I didn't come to class. So I'm doing that right now. A couple mornings a week, I get to run with some neighbor friends. And then it may look like kind of supplementing here and there we'll do some street parking, home workouts, try to get the kids involved too, which has been super fun. So trying to get that in, hopefully a mix of that 4 to 5 times a week on a good week.
Yeah.
But sometimes it looks like, hey, we walked everybody to school and back today.
Right. And I think that's super important. Like, I talk to patients about this all the time, as you do as well, is like, we've built up this narrative in our head that fitness has to be this like super grandioso long thing. We've got to dedicate, an hour 5 times a week. You've got to do this or that. And, while those things are great, can be effective, I think like you said, at the end of the day, you go through seasons of life where it's like, I just need to do something consistently. And really like what you're talking about is like consistency wins over all of those things. And, it's awesome to hear like, hey, this is the situation you're in and this is where I have to adjust. I have ideally what my goal looks like to get, but I have the ability to be flexible and pivot on those things, which is something that we see people struggle with quite often. Is they have the plan, and when the plan isn't happening, then we just don't do anything, versus like, okay, what's kind of the next step is sort of having a backup plan, or just understanding like the season of life that you're in, where you have these things within your control, some without your control. And when things are going to change, we can be flexible and just figure out the next step to stay with your overall big goal, which is just to move every day.
Yeah. I think that was like a huge shift of, like I would be somebody that if I didn't, like I missed a day on like that programming or that plan, and like the whole week was shot, and I'll just try again next week. It's like, well, I'm not going to get anywhere with that because we have lots of interruptions all the time. So that was like a huge mindset shift for sure. So yeah, I would say trying to get movement. I think with food, just trying to get, depending on like what that activity level looks like, especially for if it has been a good week and it's a higher volume week, trying to actually like feed myself enough food. And so that might look like, just having good things on hand. I know I can grab quickly that are going to be, I just try for something higher protein, some higher fiber. I personally have to do the low saturated fat thing for my own genetics. So, and I'm one, again, tracking macros all the time for me is like very overwhelming and a part-time job. So I've kind of had those like spot checks here and there, and kind of know generally like about what I can eat to reach low saturated fat goals, high protein goals, and just trying to make the majority of that some whole foods, and real foods. And
love that. And to kind of double click on nutrition a little bit here. I'm curious, do you have, so like you mentioned some specific things that you're focusing on based on your genetics, your blood work, and the things that are going to be right for you, saturated fat in particular. Like, do you have any specific, like, dare I say, I don't know how I feel about this word, but I'm going to use it, hacks for nutrition that really help you work towards those goals on a consistent basis? Things that just are good kind of like assistance for you in your nutritional goals with the things that you're doing that are specific to you.
Yeah. I think again, on good weeks, the big things I've found that are helpful is to have like, and not even like, it takes me a lot again to like meal prep and put everything in containers and all that. I think that works really great for some people, and sometimes I'm just not organized enough to get that done. So even having like, I have roasted a bunch of chicken, higher protein, low saturated fat meat. For me, there's just a thing of shredded chicken in the fridge. There's maybe a container of some cut up roasted sweet potatoes and like a roasted vegetable. And I can make different types of bowls or whatever. I think, my biggest thing I found is like I get busy and the first thing to go is consistent eating. So just having something where I know I'm going to get lunch. We're going to have, we can put this together a different way for dinner. The kids will eat it. And then just having like quick, maybe it looks like I've made some, or we've purchased some like egg bites for breakfast or, things like that. I think knowing what you will eat and can assemble quickly has worked best for us. And that, I think that can be a little less intimidating than like full meal prep.
Love that.
And I think, just those like bulk, higher protein snacks, whether that's like a meat stick or lower fat cottage cheese or, something like that. Just having quick but good things on hand.
Yeah. And I think it's, kind of what you're talking about here is the importance of recognizing your situation and what has worked well for you. For some people, like you said, it's, hey, Sunday, you spend an hour or two prepping a bunch of food, you package it up, it's in there, and you're just kind of grabbing that as you go. And for other people like yourself, it's just making sure to have bulk things in the fridge that you can pick out as you go along and sort of like get you started with making a meal or grabbing it if you need to, that you're prepared. But I think the overall thing that sounds like for you has been super successful is just having a plan and being prepared. It's similar to your exercise, right? It's a common theme here for you. It's just like, hey, I got to make sure that I am prepared for different scenarios. And here are the things that have helped me kind of be prepared for those things. So on the topic of just like personal things as well, mental health, right? That's something that we hear a lot about, and stress and anxieties and varieties of things. That's an aspect of this journey that a lot of people come into Wild Health thinking about the blood work, thinking about the genetics, their nutrition, their exercise, optimizing their sleep. And not that they're like forgetting about that, but not realizing how big of a pillar, stress and mental health is important to what we do and what a person's health in general. What are some of your ways that you kind of manage stress in your own life and some of your own personal strategies and things that you incorporate just on the mental health side of the puzzle here?
Yeah, that's a great question. I think, and, tying back a little bit, like I do recognize, heightened anxieties, worries, things like that. When I don't move or eat, like feed myself. I'm like, that's weird. I've had water today, or, why do I feel bad? So I would say that's like, definitely one component of it. And then I think other practices, I think a lot, been over 6 years or about 5 to 6 years now. After my first kid, starting routinely seeing a therapist just to check in, like brush up on what tools I can be using, having that outlet there. Learning new tools has been a big one for me. And then having a daily gratitude practice has been helpful just to kind of frame the day, get my head on right. And then again, on good weeks, my goal is to try to get in like some guided meditation. That usually works well for me as my like mindfulness practice. I've recently gotten to play around a little bit more with like EFT and tapping, because that was something I'd always, heard a lot about and hadn't necessarily tried much myself. And that's been super interesting, kind of as like a rescue technique when I'm feeling, more heavy, anxious. So yeah, more to report back on that one, because that's a new one.
You started that recently?
Yeah, I would say within the past maybe 3 to 4 weeks. I saw like somebody shared it again, and I went back to a talk Julie Fouché had previously given to the training program, and started trying it out myself, and I was kind of surprised how quickly, just in like the first cycle, just how you could de-escalate going through a couple cycles of the tapping different areas. So.
For our folks at home who don't know what it is, tell us a little bit about what tapping is. And just so everybody knows, we actually do have a resource on our YouTube channel that Julie made on tapping that I've used as a resource for people before. So if you guys are curious about tapping, if you go to the Wild Health YouTube page, you can find our tapping resource on there. But tell us a little bit about it.
Yeah. So I think, it's the whole premise is you kind of have an intention for like either I'm overwhelmed, I'm anxious, I'm, insert what you're currently struggling with. And then with that intention, you're tapping specific, meridians or kind of like acupressure points. Yeah. To kind of reset, reframe. And, ultimately, I think a long practice of this has had some stated outcomes of really rewiring brain connections and the way we think about different emotions and things that come up. That's I would say quick and dirty.
Yeah, that's awesome. It's something that I know a lot of people are curious about. And, it's the same for everything with nutrition, with fitness, mental health, like how you choose to manage those things and what things work and tools, as you mentioned, work for people, things that you have to try and experiment with. And that's one that I think is up and coming and just another strategy that may really help some people in the moment when they're feeling overwhelmed with just things in life in general. So thanks for giving us the rundown there. So anything else that you want to share about kind of your just personal health routine and the things that you do to optimize or pursue health span for yourself?
Yeah. I would say my other big ones, they're always, one of which is, I think, always a moving target for me is prioritizing sleep. I've always been a great sleeper. Like I can go to sleep, I can stay asleep. But again, being in that life stage of like, maybe the kids will go to bed quick tonight, maybe they won't. And when they don't, it's like still wanting to have that time that's like yours or nobody's awake and, needing anything. And so like, it's kind of always a moving target for me to try to continue to prioritize like that consistent bedtime. And just like go to sleep. Like things can get done tomorrow. Just go to sleep. So that's one I know is like super important and that I feel a lot more than I used to. Cause I could pride myself in not sleeping through residency and all that. So that's a big one. And then I think for my own personal journey, like adding, been a little over a year now, we added in, a sauna. We were fortunate enough we could get one at home that like fit and, all that. And that's been a huge, part of that wind down routine in the evenings. I think does help with some sleep quality. And for my like personal family history and genetic makeup, just a great addition to my kind of cardiovascular risk reduction. I would say that's my other big.
Love that. Practice. Love that. Super jealous of the sauna. That's on my bucket list of things to do to my house someday. Is to get a nice sauna that we can utilize ourselves. Because I too have some heat shock protein deficiencies in my genetics that need a little help there with some heat exposure every now and then. So awesome. Shifting gears a little bit here, outside of just your health habits, outside of healthcare, outside of the things that you do for us and anything else that you're doing healthcare related, how do you like to spend your free time? What are the things that you do? This is something that I know I've been thinking about a lot lately is we can all get hyper fixated on the health habits and the routines, and we're working with people with it all the time. And we see this in our own patients, but a lot of the joys of life that improve aspects of our health come from the things that we do in our free time and the things that we do that enjoy. So how do you spend your free time outside of your professional life?
Yeah. I would say a big one, just like within our family, as we kind of over the pandemic got into more mountain biking. And we've been lucky that so far our kids have indulged us and enjoyed it too. So we, it looked like little bike rides with kind of the seats that fit on our mountain bikes. The kids now have their own and we're starting to get them on trails. And that's just been like super fun. I mean, not only to just like be outside, be in nature, do something, kind of physically challenging, but then to see our kids learn those skills too. I would say that's been a really big one for us, for just getting outside in general, on some trails.
Love that.
And I tried to, over the past year or so, trying to prioritize like having some type of creative outlet. And I previously had in high school and early college did some stained glass, like, making some small panels or little things. So I've recently gotten back into that, and just finding like funny, quirky things you can make for people, because when they have everything, you can give them like a stained glass organ. After they've donated a kidney, you can make them a stained glass kidney.
Just hang a wall of organs that you've donated, or a wall of your favorite stained glass organs. That sounds like a good business idea. Meghan sells stained glass organs. Precision medicine physician. We can feel like this is your next big thing.
Yeah, we can market that.
I'm just picturing like beautiful like giant stained glass art of like a brain or something.
Yeah,
this is awesome.
Yeah.
I love that. That's awesome. Anything else that sort of you use to unwind or recharge on that note?
I think just kind of, we're like pretty big about just like being in and with our community, whether that's like, we had neighbors over for like a backyard movie the other night, like having pretty consistent, every Thursday we have friends come over and we do like a sauna and plunge night and make it a potluck. So just like being with folks, and especially when we get to pair that with like some fun health practices, that's been super fun to share. That's
awesome. That's awesome. And that social connection is another key health indicator we talk to people about. Is, you can dial in your nutrition, you can, hit some good exercise, get good sleep, and social connection is just as important as those things, or connection in general.
Sure.
And however you pursue that, always asking yourself, what does connection look like? And so that's really cool. I think we can all aspire to have better connections, and pairing them with health habits. That sounds like a great time. And I have to crash a potluck one time in my life. That sounds like a great idea.
Yeah, especially with cold plunge. It helps with peer pressure.
Right, totally. Sure. Oh, you got doing that on your own, man. Hats off, by the way. Shout out to anybody out there who is waking up early, solo on their own, and just hopping in a cold plunge, because that is not me. I am put me in the sauna and crank that bad boy up. The cold is I gotta work on it. On it. So, guilty pleasure. You have any in general, like guilty pleasures that you want to unveil here to the audience, so that we can all be like, I do that too? Or
I mean, for full transparency, I would say probably no judgment. Either social media or a good TV series. Like if I have an inch, I might take a mile. So that's, again, always a moving target for me to rein in, and, making sure I'm keeping the phone and social media as its rightful tool that I am using, but not being used by. That would definitely be the guilty pleasure.
Hey, we all have them. I'm well known to like a good TV show, series, and having something going for me always feels like, I always think I need to have a series that I'm like into. In some form or fashion. That's awesome. It's cool. So anything that you feel like your patients or the audience in general would be surprised to know about you, besides painting stained glass art of organs?
I don't think so. I feel pretty boring. Or maybe just surprised to know I struggle with all the same things that our patients do, right? I think just, always it is always a choice sometimes to prioritize your health and your mental health, and, not stay up late just as a boycott. Things like that. I think, knowing that while I do try to practice what I preach, it's hard for me too sometimes. So,
That's important though. Like, I think that's, back to kind of my earlier point that I really like to drive home with anybody who's ever asking about what we do here, and even just our patients who are with us, is like, hey, like a lot of the things that we talk to people about, or frankly, all of them, like we practice them, or we've tried them, or we've experimented. We have knowledge on them, and we really do try our best to make the choices to positively impact our health every single day. And that's not always a win. It's certainly not perfect. I know I certainly have a ton of mistakes and flaws within my own health, both physically, mentally, socially, spiritually, all those things. And so like, I think that's a really important point that I think it probably does surprise people sometimes, because I know you often feel like as you're working with somebody who's in this space that they must, you see it on social media on that note, like you're like, man, that person must be always doing these things. But, I think knowing that we all struggle at times is an important thing that brings us all together. And, we're all just humans trying to do our best out here.
Yeah, for sure.
All right. Here's an interesting question that I'm curious to hear your thoughts on. Trends in our space right now. Like, are there any exciting developments or trends or cool technologies, or even just like advances in science that you're getting really excited about in the near future, or that maybe are up and coming that you've been thinking about, you've been learning about, that you want to share with the audience today?
Man, I think like some general trends, and I will say like I'm not like crazy at the moment up to date on like specific timelines or molecules of them, but I think just like the trend in general of where we're going with, I would say especially like kind of that pharmacogenomics, or like using genes to determine, even if it's just like your statin or your cancer treatment, I just feel like there's just so much coming out right now using our SNPs, our, gene variants, helping to establish like, maybe full treatment plans, like for a cancer or like specific molecules, but even like as small as, hey, this statin or blood pressure medication just may work better for you. I think just saving people a lot of, trial and error, a lot of time, a lot of discomfort is super exciting. And then I would say the other one, it's hopefully coming in the near future. I think they're in like some phase 3 clinical trials, is like a medication to treat Lp(a), or like that little tiny atherogenic, more plaque forming molecule what we talk about in like your cholesterol panels. So I think both for patients and selfishly for myself, because there's not much we have to treat that, and we're kind of finding it's its own little standalone cardiovascular risk factor. So I'm pretty excited about that one.
Yeah,
hopefully
for sure.
Does well.
I think no, I love it, and I think what people can hang on for a hopeful future is a lot more personalization coming within medicine. I know that's what people are coming to us seeking, and it feels really good to be able to provide that to people and to be continuing to see advances in this stuff. And then, in our practice, I always tell people like, hey, look, we're going to utilize this data to make a more personalized approach. And then as we do that, still continue to evaluate. It's not the be all end all,
right.
Like, okay, now we're going to try this based on your genetics. However, give us the feedback. Let us know how it's working for you. We're going to track your blood work. We're going to make sure that we're doing right by you. And if we see alterations or changes based on that, like we can pivot or we can modify, we can adapt. And I think that truly is the personalized approach. So I'm excited as well. I think that we're on a really amazing track to really individualizing care the way that a lot of people are desiring these days.
Yeah, for sure. Yeah, I think that's an important caveat. I appreciate you reminding us all of. It's like it gives us like maybe a more narrow angled approach, right? But still always pairing that with like, how are you feeling? What are your labs doing? What does life look like? And always reevaluating.
The analogy I always like to use when I'm explaining this to people is, in maybe a traditional setting where you don't have all this data, it's kind of like when your doctor is walking in the room blindfolded and they're throwing darts at the board. They can't see it. So they're just chucking them at the wall, hoping something sticks in the right spot. And in our situation, we're unblindfolded looking at the board, and it might not hit the bullseye, but at least we have a better shot because we can see more clearly what the path might look like. And then from there, once they're on the board, we got to work towards moving them towards the center over time.
I like that.
It's refining that approach.
Yeah.
Well, appreciate the conversation, Meghan. It's been great getting to know you a little bit more and some of your interests. In closing here, talk to me about what most excites you about what we're doing for the future.
Like we being Wild Health, or just making sure. Man, like I said, I think I think we're, a lot of times I just see us like giving people a lot of their like daily life back, a lot of their daily activities back, just as they, or maybe like creating a lot more opportunities for their 60 and 70-year-old selves that they maybe wouldn't have had they not kind of gotten to partner with somebody to just help guide a little bit. So I know that's kind of like, vague and poetic, but just people that are like, I'm picking up my grandkids, I'm, going on hikes with them, and people that are giving to like live, maybe we're helping them live longer, but more importantly, just a better quality life. So it makes
100%.
me excited.
Do you potentially have a story that you could close on here about a patient? Obviously, no names, nothing like that. Anything recently come to mind where you've seen some really cool things happening within your practice?
Yeah, I've had one that kind of jumps out to me. Had a patient that was dealing with multiple like metabolic markers. We were working to trend in the right direction, but also some high like inflammation. And we were chipping away, like lipids were getting better, insulin resistance was getting better, thyroid numbers improving, but that inflammation piece was just like not budging. And it was like pretty high, like inflammatory markers. And this patient started like EMDR therapy, was like really started in on a lot of like trauma issues and addressing those things, and seeing inflammatory markers coming from like CRP numbers coming from like 12 to 5. I mean, like huge cuts where they had been very consistent despite other markers moving. So that was that's been like I would say in the past 6 months or so, 6-8 months. So that was just really very interesting to me. And I feel like that's been fuel to my fire to make sure I'm checking in with patients. Like, what's stress look like? What, what practices are we doing right now? And just really honing in on some mindfulness and, as part of our like inflammatory workup, or, addressing like, and within reason, right? Or like making sure they're seeing like a specialist for, trauma issues, things like that.
That's
one
awesome.
that kind of sticks in my mind.
No, I absolutely love that, because we can get hyperfixated on lowering inflammation through nutrition or supplementation or sleep or this or that, and all these kind of things, and forgetting how powerful the mind is and the impact that our mind absolutely has on our physiology.
For sure.
And how important a cornerstone piece that is. So I love that story. It's a great way to close out our talk today. And I appreciate you coming on today, Meghan, and bearing with me as I walk you through, or you walk us through your life and what things look like, and being so transparent and open. Thanks for everything that you do for us. And love working with you. Love having you as a part of what we're doing, and appreciate the opportunity to learn from you today.
Oh, well, likewise. Grateful for you. Thanks for having me.
Absolutely. All right, guys. You've been listening to the Wild Health Podcast. For Meghan Jones, I'm Steve Weatherholt, and we'll see you next time.
See ya.
Thanks so much for listening to the Wild Health Podcast. If you want more daily health education, be sure to follow us on Instagram, which is filled with health optimization how-tos, grocery shopping lists, guided breathwork posts, myth debunking, and so much more. You can find us at Wild Health MD on Instagram.